Hello, welcome to my YouTube channels. Today we are talking about a communication skills which belongs to gynae and obs. And the communication skills station name is Preeclampsia. Here, the case scenario is that you are working as a foundation year 2 doctor in maternity clinic. Gemma is a 40-year-old lady with her first pregnancy. She has come for her regular antenatal checkup. On examination, midwife found a blood pressure of 155/100 and protein 3 plus in her urine. Her BP during her first antenatal checkup was 115/60. Take focused history, discuss the management, and address the patient concerns. So, in this scenario, or whatever the scenario is, the most important part that the candidate have to look for is the task. In these questions, they have asked about 3 tasks, which is first one is a history taking, second one is the management, which includes explaining the diagnosis and the management plan, and the third one is addressing the patient concerns. So when you are going to start the station, check patient understanding, check their ideas. So what are you going to ask? Gemma, I believe you have been here for your antenatal checkup. Midwife has checked your blood pressure and has done a urine test. She was quite concerned. Do you have any idea what it could be? Okay. Whatever she tells you, thanks her and say, thank you very much, Gemma, for sharing your understandings. Before we go ahead, can I ask you a few questions if that's okay with you? Then start asking about first part of the task, which is history taking. So start with build a good rapport with the patient, ask about how she's feeling, and then ask about the gestational age. Gemma, how far are you in your pregnancy? Then, as we in any other history taking, we start asking about the presenting complaint. So this patient is coming with preeclampsia. So you have to ask about the main symptom of preeclampsia, which is headache. Gemma, have you had any headache? Any problem with your vision? Any chest pain, especially below the ribs? Any abdominal pain? By any chance, do you feel sick? Have you noticed any sudden swelling in your face, hands and feet? And the next part is asking about the risk factors. The risk factor is the first pregnancy, the maternal age, and previous medical history, which includes her previous pregnancies, blood pressure, diabetes, kidney disease, or any autoimmune disease. Then you have to ask about any family history of high blood pressure or family history of preeclampsia. And now that you have gathered the information, now you have made your mind, you're coming toward the diagnosis part. So thanks the patients. Thank you very much for sharing this information. And now start building up that, or make a signpost. Put all bits and pieces, the information that you have gathered already, and make a statement about that. So you are 36-week pregnant, your blood pressure is high, and we have found a bit of important protein in your urine. If we put these bits and pieces all together, you have a condition called preeclampsia. Have you ever heard about that? And then you have to define the preeclampsia. So preeclampsia is a condition that affects some pregnant women, usually during their second half of pregnancy from 20 weeks onwards, or soon after their baby is delivered. It is not a simple high blood pressure. It has several other complications both for mother and baby. Do you want me to talk about them? Okay. So as we discuss this, that the high blood pressure can compromise blood supply to your brain, eyes, heart and kidneys, and can cause you to have headache, blindness, chest pain and salt and water imbalance. It affects your kidney in such a way that important proteins are lost in your urine. In this case, body is unable to maintain water and salt balance and start to retain more water, which puts pressure on your heart, and salt imbalance can cause you to have fits, which is which is quite serious condition. So in severe cases, it can cause acute liver failure. So what happened with the baby? So the blood vessels in the cord, the blood supply between mother and baby is via placenta and the cord, baby cord. So blood vessels in the cord and the placenta are very delicate, not designed to withhold high blood pressure. So in this condition, there is a risk that placenta is detached from the uterus wall, impairing blood supply to the baby, which could be fatal for little one. Also, placental detachment can cause you to lose massive blood and put your life at risk as well. And we call this condition as placental abruption, which is simply that the placenta is detached from the uterus wall. Love, I'm not trying to scare you, but giving you an idea why we are so concerned about you. So now you have to, at the same time, you will be checking the patient concerns. And the very important point is when you are explaining about anything, after every 10 seconds, check in chunks. Ask the patient, are you following me? Are you with me? Does that make sense? Is there anything is not making sense to you? If you find it difficult, please pause me. So now you're going to explain about the management. So we are going to admit you to monitor your blood pressure and baby's heartbeat. We will start you on blood pressure medication. Ultimate treatment for this condition is the delivery of the baby. We will deliver you around the term time between 37 or 40 weeks, depending on the situation and your blood pressure condition. If everything goes okay, there is no harm to deliver the baby by natural birth. But if blood pressure is not controlled or baby is not doing well, we might have to deliver you via C-section. Does that make sense? And then there is a list of concerns. Patients is asking why you need to admit me. So as we discussed the complication previously, explain to the patient, as we discussed previously, that this condition could end up having quite serious complications. That's why we want to admit you and monitor you and treat your blood pressure to keep you and your baby healthy. So, and then she will be asking about my maternity leave hasn't started yet. So reinforce the idea that how serious it is and reassure the patient, Gemma, this is very serious condition. We need to admit you today. Meanwhile, your employer can be notified that you have been admitted in the hospital and your maternity leave can start earlier. Does that make sense? Okay. Then patient says, well, I have planned natural birth and water birth if possible. So you have to explain it, because we have to monitor you during your labor time, monitor you and your baby during the labor time. I'm afraid water birth might not be possible. So, but there is there is a chance that you can deliver via natural birth. Finger crossed. If everything goes fine, we can go ahead with the natural birth. Finger crossed. So the patient next concern is how long I will stay in the hospital. So you need to be very clear here. So tell the patients, we are going to admit you today, and as I have explained previously, we are going to monitor you and your baby, and we will be delivering you, depending on the situation of your blood pressure, between 37 to 40 weeks. You're already 36 weeks, so not very far. Um, because this condition can affect after childbirth as well, so we will monitor your blood pressure once you have delivered the baby. We will monitor your blood pressure and repeat your urine test. Once the results are reassuring that it is safe for you to go home, we will discharge you. The idea is to keep you and your baby well. Do you have any other concerns? Thank you very much.